Welcome to the Ordinary Doula Podcast with Angie Rosier, hosted by Birth Learning, where we help prepare folks for labor and birth with expertise coming from 20 years of experience in a busy doula practice, helping thousands of people prepare for labor, providing essential knowledge and tools for positive and empowering birth experiences.
Well, welcome to the Ordinary Doula Podcast. My name is Angie Rosier, your host, and we are here today with a very special guest who comes to us from Canada. We have Meaghan Beames with us, and she's from Toronto, Canada, and she is a craniosacral therapist. And we're going to kind of dive in today and talk about what that is and how it can help in the situations surrounding pregnancy, birth, and postpartum for both moms and babies. So, Meaghan, I want to give you a minute, just kind of give us some of your background, tell us a little bit about you, and then we'll kind of dive into our topic today.
Amazing. Yeah. Thank you for having me, first of all. So I am Meaghan Beames. I'm a registered massage therapist. In Canada, we are registered. We're not licensed. I mean, we are licensed, but we call ourselves
That's your
registered.
term.
Exactly. And I'm also a craniosacral therapist. So I have been treating babies since 2018 using craniosacral therapy. The most important time to be getting cranio is right after being born, because like I said earlier, the number one trauma that every human experiences is being born, and that stays in our body. So if this baby experiences a very traumatic birth or a long pushing stage or an emergency C-section or experiences being born,
Well, and anyway,
just born,
yeah,
just being born, that can result in tension, right? And then that could result in a baby having a side preference. Maybe they like to turn their head to one side only. Perhaps they have, they're cutting up the nipple within days after being born, or they're falling asleep at the breast and they are not feeding very well. Perhaps they don't like tummy time, and then now they're getting a really flat head. Now, now we're working into things that are lifelong, right? Because those things this is not fear mongering, this is information. Those things tend to turn into either speech delays, mouth breathing, crowded teeth, poor oral health, poor oral functioning. And, and so when we can address these things early on in this infant's life, we can avoid so many things later on, even into adulthood, like migraines.
Yeah, excellent. So tell me again, in a perfect world, a baby's born, however it is they're born. When is a good time tell us when's a good time for that first visit?
So let's talk about preemies who have time in
NICU
NICU.
time.
Yeah, NICU time. They need to be seen. They can be seen. I have practitioners, because I train practitioners who work in NICUs. They see them starting at 36 weeks in the NICU.
Okay.
So they can, and they do even less than 5 grams of pressure of touch. They generally do very gentle, even more gentle touch on these 36 weekers. So, and that's when, the skin, there's a lot more integrity to the skin, and you don't need to worry about that. And then after that, let's say it's a term baby, they can be seen within the first 24 hours. Some of my practitioners who are lactation consultants, go in within that first 24 to 48 hours. They do the releases, and they barely need to go back for lactation care, because this baby, that, the initial tension. Exactly. So the sooner the better. However, if you don't get that time in, it's not too late. It is never too late. I see babies 3 months, 6 months, 9 months, like starting at that time. Okay. And we can still see improvements and results.
Okay.
So it's never too late.
So tell me, what do you see are if there's a top 3 things that we could say common baby complaints, right? Whether that's colic, whether that's sleep challenges, whether it's feeding challenges. What might be the top three baby ailments, if we call them that, baby challenges that craniosacral could address?
Um, Poor feeding, just
Okay.
not, if whether it's painful latch or this person is like, I'm going to go right to bottle. And now on the bottle, they are just uncoordinated and
They're
having a
also
really
not
rough
doing
time.
well, right?
You're also not doing well on the bottle, right?
Yeah.
Craniosacral,
Yeah.
100%. And
And
not
that's
like
what, as
maybe craniosacral,
just do
like
it.
maybe. It's like time is of the essence. Please do it now. You're going to suffer for the next 3 weeks while you think and ponder whether
Right. When you
craniosacral is
could
right.
have it
Just
done.
do it.
So the
Just do it.
results are kind of quick, right? Like you get this
Definitely,
craniosacral
yes.
done, and we're going to have some pretty quick turnaround responses in that baby's body.
Usually within 24 hours, 24 to 48 hours, this parent is like, "What? I have a new baby."
Cool. Okay.
After the first session. And then
Yeah.
they need to continue because there's some more left over. We can't get everything in the first session. So,
Hmm.
minimum 3 to 4 sessions usually.
Yeah. Cool.
Um, and so feeding challenges,
Number one.
body or doesn't matter. Number one. Number
Okay. And I
two,
will say on that number one, as a
yeah,
lactation consultant, so often when I'm working with a client, that's the thing. There's we try all this stuff and we can't figure out what's gonna make the difference on the breast, on the bottle. Even I had a baby a couple weeks ago, would not suck. Like would not even suck. And that's a problem, right? Like this baby was beautiful delivery. I mean, it was still, right? It was a delivery. So babies, it's work on the mom and the baby. I was not there for it was a home birth. I was not there for the presence of it, but based on I saw him within 24 hours because the baby was not sucking at all. And that's what we went to. I said, do some cranial. It took me, I tried all my tricks and did, I saw them
yeah,
3 times in a couple of days because we needed that baby to eat. And craniosacral was this some body work, right? Like it
yeah.
was key. It was amazing.
We just got to get the nerves to function. If they're not sucking, the nerves are not functioning well. It's not functioning optimally, right?
Yeah.
And so that would have been the facial nerve, the trigeminal nerve, and the vagus nerve. And we can just go in, do a little bit of work, and boom, those nerves work better, and the suck reflex comes online.
Comes on like it's supposed to. Very cool. Okay.
Yeah.
Okay. Great. Number one, feeding's important. Okay. What's next?
Number two, not pooping every day.
Ah, there we go.
Okay. The people who are like, oh, it's fine. They're on breast milk. No, that is a sign you've got slow digestion. That is a sign that your nerves going to your digestive tract are off. That includes adults. If you're not pooping every day, go see a craniosacral therapist.
Hmm.
Okay. Yes. Yeah.
Cool.
There is something that is off. See the cranio and then add some more fiber if you're not going every day.
Okay. Okay.
But to me, that's a sign that there's something in their spine. There's either something in their spine that maybe there's a twist or tension that's throwing off the signal from the brain to the intestines. And so the intestines are moving slowly. So they're gassy, they're grunty. They might have a distended belly button or a distended belly,
Mhm.
hard, and they're really struggling. Craniosacral therapy.
Okay.
Yeah.
Excellent. Cool.
And then
That's
number three,
yep.
yeah, I can expand always.
Cool, cool. So that brings me to the gassiness of babies, right? Some
Yeah.
babies they're uncomfortable, they're squirming, they don't rest they never rest into their bodies super well. I know they have immature digestive systems for a few
For
months,
sure.
and I had my mentor who I spent a year with becoming a lactation consultant. She did home visits and worked in a hospital and did office visits, but she oftentimes would have a craniosacral therapist meet her at the appointments. And it was amazing to see in
Yeah.
conjunction, right, with lactation consultant, see the work that happened very quickly on site and the effects that had on babies. So again, I wish I
Absolutely.
had you in my back pocket. Come to appointments. It'd be great.
We need to get more of us.
We do.
Um, yeah, no, and you make a great point. Sometimes it really is an immature gut, and so there's, the baby can't actually digest the food that's in there. Um, However, we can help that digestive tract move along a little bit better, with the help of, let's say, probiotics or
Yeah.
increasing the gut microbiome of the person who is feeding them. So
Mm-hmm.
that
Cool.
is,
Very
yeah,
cool.
we can do those things as well.
Okay.
And the last and final thing, and this is the one that I'm like, please, 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 go see a craniosacral therapist, is if your baby isn't meeting milestones,
Mm,
any milestone. Okay, because the human body is designed to work. And let's say they've got genetic things that are keeping them from meeting milestones. That's not what I'm talking about. Or perhaps they have cerebral palsy because of birth trauma. Um, that's not what I'm talking about. Although they can benefit, but I'm just
right.
talking about the babies who don't have those things, and they're not meeting their milestones. They're not rolling. They're not pushing up.
Mm,
They are, or they're not crawling. And this person's like, just gonna go straight to walking. No, 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 please,
mm.
please, please.
Yeah, they
It
need
is
to
incredible.
crawl.
They need to crawl, they need to roll, they need to spend time comfortably on their tummies for brain development, right? It's not just milestones to tick a box. It is literally brain development it is paving the way for their future adult life,
Mm,
even their future child life.
mm,
So getting them to meet milestones, if they're not meeting it, sometimes it's because something hurts in their body.
mm. And they
You
can't tell
know,
us that.
they can't. They can't. They just, parents just say, oh, they don't like tummy time, or they roll immediately out of tummy time, or, something like that. And that to me means, okay, well, what can I find in their body that is feeling uncomfortable? Maybe it's their front body is really tight. Maybe their
Right.
hips are locked, maybe, and it feels like a deep stretch in their front body. Or maybe there's something off in their hips and then or along their spine. And when they do that, it feels like they're pinching their back, right? So we can
Mm,
find these things. The other thing is some babies, when they're in tummy time, if they've started to get kind of a flat head, um, those babies often feel lightheaded in tummy time.
interesting.
Yes, because the blood can't drain super well. So with a craniosacral therapist, we can go in, not only can we help the body, but we can also help reshape the head so we can get more drainage, even an optimal head shape. We can do head reshaping, remolding, that type of thing.
Wow.
Um, yeah, just
Very
to
cool.
really help with those things. And that's again for really optimal or as optimal as we can get for this baby
Right.
brain development.
Okay. Excellent.
Yeah.
So I'm gonna ask again, I didn't prepare you for this question either, so hopefully it's okay. Um, Tell me about like with tongue ties, lip ties,
Mhm.
any oral restrictions. How might craniosacral come into play in situations where we have that, whether it's released or not?
Absolutely. So I work with families who do both. So they either choose to release or choose not to release. And I am happy to support both. And when I'm training practitioners, I say we are here to serve the family. We are not here to put our opinions on. We are here to serve. So um so with a tongue tie, right? Let's say this baby was diagnosed with like a tie that goes right to the tip of their tongue. Okay. That started in utero. They probably are very tight in their front body because it's attached all the way
Right.
down
It's
into
not
the
just their tongue
intestine.
that we're talking about, right?
Exactly. Exactly. There's that. It that attaches all the way into the intestines. So there's tension and there's pulling and there's lots of fascial restrictions in that area. And they've never had a tongue that moves. So if they choose to go in and release that tongue, well, it's been living at the floor of the mouth. That's all it knows. So we
It's
want
gonna
to,
go
and
back.
it's going to go back and it's being pulled that way. And so it's going to go back and it's going to reattach. So getting the cranial before release is very important so that we can say, hey, tongue, we know that you live at the floor of the mouth, but we're gonna get the stuff in your neck and in your collarbone and in your chest. We're gonna release that so that your tongue
Your
can
tongue
live at the
can move. Very
exactly.
cool.
It's not being pulled down by fascia lower. Now if they choose not to, or actually let's go back a little bit. Um, well, if they choose not to, we can encourage more movement by giving some like stretching under the tongue. Even on their chin and in their this is called the hyoid, so right in
Oh
the
yeah, that
hyoid.
floating bone.
Yeah, Yeah, the floating bone in there, we can wiggle that around because there's so many muscles that are attached to that, that can help relieve some of the tension that builds up in a tongue tie. And it will always build up with a tongue tie. So, daily relief of that tension. And then let's say they are diagnosed with a posterior tie. Okay, so this posterior tie is very much like that tongue tie, the one that goes to the anterior tip of the tongue, where this baby doesn't have a fully functioning tongue. It can't do all of those movements. And it could also be pulled down by other parts of the body. So we release those so the tongue can raise to the roof of the mouth. So that when they do go in, or if they choose to go in and get a release, the tongue doesn't then sit at the floor of the mouth. Now let's get to the ones where, let's say they were diagnosed with a possible posterior tie. They go in for a tongue tie revision and there are no improvements. That to me tells me that it's not a tongue tie, that possible posterior tie was actually cranial nerve dysfunction. And that the tension that was experienced in the tongue was due to something, a nerve that wasn't functioning.
Okay.
Yes. The nerve was not functioning, and that causes hypertonicity of the tongue. So it acts like a tongue tie. So this is why getting the body work before the tongue tie release is so very important, because what if it's not a tie?
It could prevent.
And then they release.
Yeah, interesting.
Yes, exactly.
So like you said, any baby that's born could benefit from.
Were they born? Amazing. Cranio.
Get some craniosacral.
Yes.
Very cool. Yes. So this could, for those situations with tongue or lip ties, that a release, or buccal ties where a release is required, like if they need to do a revision, like craniosacral is going to be good before, after, but it sounds like in some cases it could prevent the need of a revision. So maybe start there for those who are open to that. Start there with some craniosacral work if we're looking at, and I just met with somebody yesterday. There's some signs of tongue tie for sure. I didn't look immediately in the mouth, but there's some notable signs that this baby could have a tongue tie. But the mom's milk supply was phenomenal. So baby's growing well, eating quickly. But then when we got in the mouth, it was pretty obvious, pretty tight lip tie and a very, prominent tongue tie as well. And the mom was so cute. This baby's 2.5 weeks old. She was kind of crushed by that. And I just said, it looks like, I noted the presence, said, this is what we can kind of see. And then we go into what could be done about that. But she was really, I love the words she chose. She said, "Oh, this is the first thing that hasn't been perfect about her." And I said, "Oh, no, it's not that, she's still absolutely perfect." But it's something. And as they talked, both mom and dad were there. They said, "Gosh, it's hard to make decisions, right? To like make parenting decisions. They now have to, and I'm not the one to follow up with, they're going to look at like an ENT or pediatric dentist, of course, and choose if they want to do that. But this information, and I did tell them there's some good body work. I'm going to call them up today and say, hey, because she doesn't want to have to do a procedure, right? Like, even though it can be very effective in some situations. I love that there are other options for people to know about.
Yeah. And, her story isn't uncommon too. There are so many parents who choose not to because they don't want to have to make that decision, and their choice is to not put their baby through that procedure. And I support every choice, whether they put them through the procedure or don't put them through the procedure. That is their individual choice.
Absolutely.
My goal is to avoid.
Mm-hmm.
My goal is to avoid.
Minimal intervention.
Because I've seen too many babies who have gone in for a tongue tie revision and then it made it worse.
Yeah. Or it didn't make a difference, right? They chose to do it. Sometimes it's life-changing, right? Sometimes it's life-changing and we've got a baby who can now suck and swallow, and
absolutely.
But other times, it's not, they make that choice and it didn't do what they hoped. Yeah.
And so, it's so hard, but you don't know.
Yeah.
We don't know.
But with craniosacral, it sounds like that is a very benign effort, right? It's going to have positive impacts, even if it's not on specifically on the tongue, or that, any kind of fascia tight that that's impacting feeding, we're going to have positive impact. It's not going to be a no
Absolutely.
impact experience. Yeah. Very
Exactly.
cool.
Presence of tie or not presence of tie, it's going to have a positive impact for sure.
Yeah. Very cool. Very
Yeah.
cool. So, and I've taken a client to with a baby. You talked about a rebirth process for babies. This client was born by cesarean, or the baby was born by cesarean, and super tight. Like she probably didn't go to cranial till she was about 3 months old, but she was always just crunched to her right side, I believe it was. And this craniosacral therapist took her. She took her through a rebirth, like her position. She took her off the edge of her table, and
Yep.
it was pretty fascinating work. And that baby did loosen up. She was able to be much more comfortable and continue to grow and develop. She's 4 or 5 years old now, so cute. But yeah, it was cool to see a rebirth experience for
Yeah, they're
a baby.
fun. They're fun. And there are different practitioners who do it in different ways. I will say that there are some who I like the way that the practitioner you described did it off the edge of the table at 3 months, right? So this
Hmm.
baby's a little older and they have the musculature to support the weight of their head
Hmm.
while upside down.
Interesting.
The
Yeah.
younger, yes. So I do caution about, holding the head upside down unsupported for the younger ones because tractioning of
Right.
very delicate structures like the brainstem and other nerves that go down the spine and through the neck. Um, so there are ways of doing it, but the younger they are, the more support of the weight of their head they
They're
need.
gonna need.
And the
Mm.
older they are, the less support they need
Yeah.
while they're going through this
Interesting.
rebirthing experience. And it's pretty cool.
Yeah.
It is very fun to experience.
So you brought up another question, if that's okay. Um,
Yeah.
so tell me about, I mean, I know it's going to be amazing, but the impact, like to a baby who's born with instrument assisted delivery, whether that's a vacuum or forceps. So I've seen
Yes.
lots of those. I mean, not proportionally a few, right? But I have seen that numerous times in my career, whether it's vacuum or forceps. Um, I know that's crazy kind of traction when you just said traction on that head. So tell
Yeah.
me, in those situations where craniosacral could come into play when we have an instrument assisted delivery.
For sure. So I want to preface this and say that I am very sensitive to the fact that perhaps the parents who are listening have either had babies who have experienced this or they fear these types of things. What I want to say is yes, they can be pretty traumatic for the baby's experience. However, with cranio, we can really help their body release those areas and process what happened or their experience. So that's my little caveat to that. But so with um vacuum or forceps um assistance, let's say, um the tractioning with forceps, let's say the forceps not only do they traction, they also compress
Mm,
the cranium, right? And so there are some adults who, when they go through their rebirthing experience, um, they talk about how painful the forceps squeezing their head was, right?
mm,
And they realize that that pain is the same one that they experience for their migraines,
mm,
and so that those forceps, that feeling of being squished
that
can
compression.
stay.
Yeah.
Yes, exactly. So what cranio does is we feel into those cranial bones. We can even feel into the tissues, listen to the tissues underneath the cranial bones, and feel for tension, right? I was saying that even around the brain is fascia. So we can feel that fascia and we can release that fascia. And so this baby who has this squeezing effect, we can release that so that lifelong, they don't have to
Mm.
experience those migraines, those headaches that they possibly could in their adult years.
So you can
Um,
prevent a lot of down the road challenges early on.
absolutely,
Cool.
absolutely. Um, Speaking of which, I was in a lift the other day and this man was like, "Oh, I couldn't work." He was my driver. He was like, "Oh, yesterday I couldn't work. I had a migraine. I get them every couple of months." And I looked at his head and I was like, "Oh, where do you get your migraines?"
You
And
can
he was like,
tell
"Oh, I could tell. I knew exactly where he got his
looking at
migraines."
it.
And he was pointing at his left side, his left eye, and all the way behind his back of his left ear. And I knew that when he was a baby, he had a left side turning preference because
Mm,
that side was just flatter than the other side.
interesting.
Yes. And I was like, you should go see a craniosacral therapist. Here's the person you're going to go see.
Take care of those migraines.
Work on those migraines. So that's I don't know if I didn't ask about his birth. It was only a 10-minute ride. So but
You can do what you
I did
can
tell
in
him what
the
I did
ride. Yeah,
for sure, for
very
sure.
cool.
But so for forceps, there's that squeezing, but then there's also that pulling, like
Yeah.
pulling on the neck. And so um pulling on the neck can then cause this baby to have like a very, we're going to use air quotes here, lazy feed, because
Yes.
they're in
Yeah,
pain.
yeah. They
They're
do not like
just,
to latch. And the suction they need to create in their head with that kind of
oh,
pressure on their head, it's painful for them.
they've already got a headache. They don't
Yeah,
want to
yeah.
increase the pressure in their
Yep.
head. They don't want that. They're just going to be like, no, thank you.
Yeah, I'm not going to
Let
eat.
me sleep for a few days.
Yeah.
Yeah. So the sooner those babies, the forceps babies can be seen, the better as well. Again, incredibly gentle touch. We do not, and for those babies, it's even less. We might even use like 1 gram of
Wow.
pressure,
Wow.
which is almost nothing, right?
Yeah.
Which is like essentially intention. So, so yeah, we use very, very gentle touch. Now, when it comes to vacuum, there's this suctioning, right? So it's a literal vacuum on the
Yeah.
skin of the scalp, right?
Yeah.
And how many of you have had a hickey before? You know what I'm saying? It
This is a
doesn't
big
feel
one.
good. It's a big hickey, okay? So there's going to be pooling of blood, there's going to be broken capillaries, it's going to be painful. Then there's going to be a bruise, and bruises are
Yeah.
painful, and so and then, pulling again of the cranial bones and the fascia that surrounds the brain. This can cause headaches, um, and also a very, slow to feed infant, um, and cranial nerve dysfunction in their mouth. So
Mm.
lots of things. It can produce lots of things. And just like we do with forceps, we go in, we feel what was produced, the tension that was produced. We feel for that. We encourage it to let go. And usually this baby is thriving in a few days.
Interesting. Okay.
Yeah.
So especially when babies, well, like you said, anybody that's born, but instrument assisted deliveries, any what might be perceived by mom or baby as a traumatic birth could be
Yes,
benefited by craniosacral pretty quickly.
absolutely.
Oh, awesome.
Absolutely.
Cool.
Yeah.
Cool, cool. I love it. Okay, any last little nuggets about how craniosacral benefits babies as we wrap up this episode?
Um, you know, I, I think that, and we've said it many times, every baby can benefit. I realize that it's not in everyone's financial capabilities to go out and seek care. So if that's out of your realm of possibilities, touch your baby with gentle touch
Hmm.
all over. Gentle, like very soft, gentle massaging, like as soft as you think you're going, go softer.
Hmm.
Touch, right? And very slow. It's not like petting. It's not like, you know, you know, massaging either.
Right, or very light. Okay.
It's
Kind of like
almost
if you're
like you're
touching
just,
butterfly wings, right? And you don't want to damage the,
yes,
okay.
exactly. And but slower, right?
Hmm.
Um, and that you might even notice your baby sleeps really well tonight.
Yeah.
You just drag your fingers really slowly along their spine. Just dragging, right? You connect in a way that you're not sweeping along the skin, but you're kind of dragging along the
Hmm.
skin. Um, your baby might sleep really well tonight.
Huh.
And then, or have a massive blowout later.
Yeah. A release of intestinal content.
Yes,
Awesome.
exactly.
Okay. Okay. Awesome. Well, Meaghan, thank you for sharing your expertise today. I have learned so much. This is a practice that I've come to really appreciate for myself. And thanks for exploring that with us, both for adults, for moms, for babies. It sounds like this is something that everyone who is born can benefit from. I love that. Cool, cool. Well, Meaghan, thanks so much for being with us here today. We appreciate your time. And again, this is Angie Rosier with the Ordinary Doula podcast. I hope that you can go out today and do something that you absolutely enjoy, connect with another human, and make a difference in the world for good. We will see you next time.
Thank you for listening to the Ordinary Doula podcast with Angie Rosier, hosted by Birth Learning. Episode credits will be in the show notes. Tune in next time as we continue to explore the many aspects of giving birth.